How to treat and cure celiac disease. Normally, the body's immune system is designed to protect it from foreign invaders. When people with celiac disease eat foods containing gluten, their immune system forms antibodies to gluten, which then attack the intestinal lining. This causes inflammation in the intestines and damages the villi, the hair-like structures on the lining of the small intestine. Nutrients from food are absorbed by the villi. If the villi are damaged, the person cannot absorb nutrients and ends up malnourished, no matter how much he or she eats. Other causes of malabsorption include heredity, medical procedures such as surgery, pregnancy, or childbirth, diseases such as viral infections. Symptoms of celiac disease. Symptoms of celiac disease vary among sufferers and include digestive problems, abdominal bloating, pain, gas, diarrhea, pale stools, and weight loss, a severe skin rash called dermatitis herpetiformis, anemia, low blood count, musculoskeletal problems, muscle cramps, joint and bone pain, growth problems and failure to thrive, in children, seizures, tingling sensation in the legs, caused by nerve damage and low calcium, aphthous ulcers, sores in the mouth, missed menstrual periods. There is no cure for celiac disease. The only treatment is a gluten-free diet. Celiac disease patients vary in their tolerance of gluten. Some patients can ingest small amounts of gluten without developing symptoms, while others experience massive diarrhea with only minute amounts of gluten. The standard treatment calls for complete avoidance of gluten for life. The principles of a gluten-free diet include: avoid all foods made from wheat, rye, and barley. Examples are breads, cereals, pasta, crackers, cakes, pies, cookies, and gravies. Avoid oats. Some patients with celiac disease can tolerate oats in the diet, but long-term safety of oats in celiac disease patients is unknown, and some oat preparations can be contaminated with wheat. Thus, it is probably best to avoid oats at least during the initial treatment with a gluten-free diet. Once the disease is in remission with a strict gluten-free diet, it may be possible to reintroduce small quantities of oats into the diet under medical supervision. Pay attention to processed foods that may contain gluten. Wheat flour is a common ingredient in many processed foods. Examples of foods that may contain gluten include canned soups, salad dressings, ice cream, candy bars, instant coffee, luncheon meats and processed or canned meats, ketchup and mustard, yogurt, pasta. Beware of tablets, capsules, and vitamin preparations that contain gluten. Wheat starch is commonly employed as a binding agent in tablets and capsules. Gluten also can be found in many vitamin products, and cosmetic products such as lipstick. Avoid beer, but wine, brandy, whiskey, and other alcohols without barley are fine in moderation. Avoid milk and other dairy products that contain lactose. Untreated patients with celiac disease often are lactose intolerant. With successful treatment, dairy products can often be reintroduced slowly into the diet later. Consult dietitians and national celiac disease societies for lists of gluten-free foods. Read the food and product labels before buying or consuming any product. This is necessary, because a manufacturer may change a product's ingredients at any time. A product that was gluten-free in the past may now contain gluten. Even branded products may be gluten-free in one country but contain gluten in another country. If one is not certain after reading the labels, call the manufacturer. Because people with celiac disease who have severe malabsorption can develop vitamin and mineral deficiencies, vitamin and mineral supplements are important. Ask your doctor if a multivitamin is right for you. Patients with iron deficiency anemia should be treated with iron. Patients with anemia due to folate or B12 deficiency should be treated with folic acid and B12. Patients with an abnormal protein should be treated with vitamin K. Patients with low blood calcium levels or with osteoporosis should be treated with calcium and vitamin D supplements. Currently, the only treatment for celiac disease is a strict, lifelong gluten-free diet. Eating gluten, no matter how small the amount, can damage the intestine. A gluten-free diet means avoiding all foods that contain wheat, rye, and barley in all forms. It is important to read all labels carefully for these ingredients, as sometimes they are listed under less common names. For example, wheat may be referred to as spelt triticale or quercetin on an ingredients label. Despite these restrictions, people with celiac disease can eat a well-balanced diet with a variety of foods, including bread and pasta. Many gluten-free alternatives are now made with potato, rice, soy, or bean flour. In addition, plain meat, fish, fruits and vegetables are naturally gluten-free, so people with celiac disease can continue to eat these foods after diagnosis. For a quick overview of the gluten-free diet and a list of some great alternatives, visit our gluten-free diet page. Following a gluten-free diet may seem daunting at first, but, with a little creativity, anyone can make delicious gluten-free meals. Visit the gluten-free recipes section for delicious meal ideas. Following a gluten-free diet should result in improvements in symptoms within weeks. Many patients report symptom improvements within 48 hours. In children with celiac disease, the response to a gluten-free diet can be dramatic. Not only will diarrhea and abdominal discomfort subside, but behavior also improves, and growth resumes, with rapid catch-up in height. These improvements in symptoms are followed by reappearance of intestinal villi, finger-like surface projections in the small intestine that are damaged by gluten. Complete normalization of the intestinal villi may take months. In many adult patients, the improvement in symptoms is followed by only partial regeneration of intestinal villi. In patients with dermatitis herpetiformis, the skin lesions also will gradually improve with a gluten-free diet. Often a medication called dapsone may be used for a short time to speed up healing. Many patients with celiac disease may not understand the importance of lifelong adherence to a gluten-free diet. Many of those affected do not follow the diet closely. People who are poor and undereducated are most likely to have trouble following the diet, as are people who were diagnosed when they were children. Person fails to respond to a gluten-free diet. Failure to respond to a gluten-free diet can be due to several reasons. A person doesn't have celiac disease but a condition that mimics it. A person is unknowingly ingesting unsuspected sources of gluten such as starch, binders and fillers in medications or vitamins. A person may have another coexisting condition such as irritable bowel syndrome, bacterial overgrowth of the small bowel, microscopic colitis, or pancreatic insufficiency that are causing the symptoms. A person may have refractory disease, or complications of celiac disease. Refractory celiac disease. Refractory celiac disease is a rare condition in which the symptoms of celiac disease, and the loss of intestinal villi, do not improve despite many months of a strict gluten-free diet. Before making a diagnosis of refractory celiac disease, it is important to exclude complications of celiac disease and other coexisting conditions that can produce similar symptoms. It is believed by experts that sometimes refractory celiac disease can be a premalignant or precancerous condition. The treatment for refractory celiac disease is first to make sure that all gluten is eliminated from the diet. If there still is no improvement, medications are used. Corticosteroids, such as prednisone, have been used successfully in treating some patients with refractory celiac disease. Immunosuppressive drugs, medications that suppress a person's immune system, such as azathioprine and cyclosporine, also have been used. Corticosteroids and Immunosuppressive drugs are potent medications with potentially serious side effects. Many patients with refractory celiac disease are malnourished and have weakened immune systems, and corticosteroids and immunosuppressive agents can further increase their risk of serious infections. Other new treatments include biologics and stem cell transplants, but these may also have very serious side effects. Thus, doctors experienced with treating celiac disease should monitor treatment of refractory celiac disease. Unfortunately, in some people diagnosed with refractory celiac disease, malabsorption and malnutrition progress despite drugs. In these cases, nutrition must be given intravenously. Total parenteral nutrition, TPN, is a way of delivering calories, carbohydrates, amino acids, and fat in liquid solutions via a catheter that has been inserted and secured into a vein.